Good afternoon from London. Good morning if you're watching from North America, and good evening to those of you who are watching from countries further east. I'm Edward Lucas. I'm a senior fellow at the Centre for European Policy Analysis. And I'm very pleased to be joined here on a panel to discuss the pandemic, perspectives on the pandemic from Prague, Riga and Tbilisi, with my guests from Prague, Riga and Tbilisi. From Prague, we have Dr. Olga Loblova, who's normally based at Cambridge University, but when the music stopped, you were in Prague, and that's where you've been during the pandemic. And we have Dr. Ugo Dumpis from Latvia, who is become, I think, a celebrated public figure in Latvia as the country's expert on the pandemic. And Latvia has an enviable record in keeping infections and cases very, very, very low, something that countries such as Britain might look at with envy. And last but not least, we have Dr. Amiran Gamkrelidze from Tbilisi, the capital of the Republic of Georgia. And he is the head of the Lugar Lab, as it's known colloquially, from the Centers for Disease Control. It's one of the most important American public health facilities based outside the United States. It's a very high profile example of the American presence in Georgia. It's also been the subject of repeated Russian disinformation attempts, portraying it as something very sinister, bioweapons and so on. But it's actually during the pandemic really proved its worth in terms of Georgian public health by being a center of expertise in countering the pandemic there. So we're going to go to all our panelists in turn to give us the latest from where they are and how they see the pandemic. We will then get into a Q&A and discussion. Again, welcome to all the people who've tuned into our event on YouTube. And I'm going to go to you first of all, Dr. Gamkrelidze. Please tell us what's the latest from Georgia. How are you doing? You need to unmute, I think. Dr. Gamkrelidze, you need to unmute your microphone. We can't hear you. I'm still not hearing you, Dr. Gamkrelidze. Oh, that's better.
Yes.
Now,
No,
go ahead.
It's okay?
Yeah.
Yeah, thank you very much for the invitation to this very important panel for the discussion. I'm very pleased. I will make a small, the correction of my introduction. I am a director of National CDC, and the Lugar Lab is a part of National CDC. It's a laboratory part. Regarding the epic situation in the country on the coronavirus infection, Georgia still is keeping under the control the infection. We have one of the, in our region, lowest, the figures. We have totally since January, 879 confirmed cases in the country. Among those, the active cases are 100 for today and 141, and 82% are already recovered. And unfortunately, we have 14 deaths in the country. So we are doing the testing. We have not so high as Latvia or the or Czech Republic per million population. Georgia is, a small country with 3.7 million population. We have 22,190 PCR tests per million. Altogether, we did 82,000 PCR tests. Of course, the rapid test plus the rapid test is maybe plus around 20,000, but we are not calculating here the rapid tests. As I mentioned, still we are keeping the infection under the control. And since 27th of April, after all the lockdowns and the quarantines, what we started, the preparation process in Georgia to the pandemic started in the middle of January. Already 6th of January, we reported to Ministry of Health regarding the new infection, what happened in China. And we have established in the country special task force or the coordination body under the Prime Minister. end of the January. We started the testing beginning of February in the country. First of all, everything was done in Lugar. In Lugar, we have a quite good by WHO accredited the respiratory infection lab, which every year is accredited by WHO, and very well prepared. I mean, the molecular biologists and the, in molecular technologies, experienced people, and we got the first primers and the PCR tests. I mean, there's some primers from the Charité and the Bundeswehr Institute of Microbiology, which is our very good partner, and we started since, I mean, the February, the testing in the country. All, I mean, the measures, restrictive measures started in the country, beginning of, the first case was confirmed 26th of February. It was imported case from Iran by Georgian citizens. And then was mostly the imported cases from, I mean, mostly from Italy by the Georgians who I mean, they went for the holidays in Italy. We started, I mean, the restriction measures and very strong restriction measures already in end of February. We stopped the flights with China, then was stopped flight with Iran, and then with Italy. We have introduced, as I remember, 22nd of March, the state of emergency in the country, stopped the education in the school and in kindergarten and the universities, and was made the end of March, very strong lockdown when we stopped the movement of transport between the big cities, even in Tbilisi as well. And the relaxing of this restrictive measures, we started 27th of April, and the government has introduced there is a state, I mean, the governing or coordinating body chaired by Prime Minister, where the NCDC is a part of this body as well, National CDC. And the relaxing measures, we started 27th of April. We have so-called the six steps, I mean, the relaxing program. 6 phased programs. Every phase takes 2 weeks, and this, I mean, the next step is taking after the assessment of the epi situation. Currently, since yesterday, we opened the internal local tourism in the country, and we are waiting, and we have a negotiation with some, I mean, the green countries in Europe to start as well the international tourism. You know, the tourism is one of the major income for Georgia, and we had last year 10 million tourists. Of course, we are not expecting in this year 10 million, but we want to have some bilateral negotiations are ongoing with Baltic countries, with the Balkan countries, with Czech Republic as well, with Israel, and with less affected countries. You know, the around of Georgia, our most closest neighbors in countries like Russia, Armenia, Azerbaijan, and Turkey, the epidemic is quite strong in comparison with Georgia, and we have still, I mean, closed the borders with these countries, and we have very strong border control. Everybody coming in Georgia have to pass the quarantine, 2 weeks quarantine obligatory, and during the quarantine we are testing by PCR, and on the 13 and 14 days of the living quarantine, everybody is testing. And with this, I mean, the measures still we are, I mean, controlling the infection. Step by step, we have opened the economy. Currently, fast, maybe say that's the 80% of all, I mean, the big or the small economies are opened in the country, as well the restaurants, cafes, etc., etc. As well the movement by the railways, by the cars between cities. And as I mentioned, since yesterday, we opened the local tourism, and this is a special slogan for Georgia that Georgians should know their own country, the Georgia, much better than they know. It means that we advocate the Georgians to spend this year mostly in Georgian, I mean, the very attractive touristic destinations, and to motivate those to spend the money inside the country. Of course, since the 1st July, we are opening as well the international tourism and the flights. Still, we have, I think, twice or three times a week by the Georgian Airways, the flights with the European countries, but all coming, they need to have a 2 weeks very strong quarantine, or maybe are some exceptions with some, I mean, the previous testing for some self-isolation, but we are avoiding self-isolation step by step. This is the, I mean, the, how to say, shortly.
Very good. And Doctor, can I just ask you, on your sixth step away from the lockdown, where are you on a scale of 1 to 6? Which phase have you got to?
I think we finished already 5th.
Super. Okay, well, on that note, I will turn to Dr. Dumpis in Latvia, which has also had an excellent record of containing the virus. And could you do just exactly what Dr. Gaukulidze did by telling us where you are and how you got there?
Okay, we have 1,098 cases so far, and 28 patients died. And for the last week, we have on average 1-2 cases per country, new cases, and we have 7 patients hospitalized at the moment, and 1 is in critical care. So these are the numbers, and they are getting better in the last 2 weeks, despite the relaxation of measures and opening of borders. Latvia never had the lockdown. We had some restrictions introduced in 12th of March, because when we had 6 cases in the country, we knew that the cases will be coming from Italy and from Europe, and we introduced social distancing or physical distancing measures, that is 2 meters and 2 people allowed to be together, or family household. So our restaurants remained open, the factories were not closed. So public transport was working, but there were limitations. Still people were limited to meet up, and schools were closed and universities were closed for distant learning. Kindergartens were partially open. So that helped us to remain low infection rates, and we never had this full-scale epidemic in the country. We had like cluster-type outbreaks, and we still have cluster-type outbreaks, very often related to visitors or repatriants from abroad, let's say. What we did, another thing in the very beginning, we understood, we learned from the experience of other countries that the hospitals or nursing homes are the main target for the virus. And we locked the hospitals and nursing homes. Basically, we didn't allow other people to go into the buildings. We advocated universal mask usage in hospitals, staff and patients in nursing homes. And we also stopped elective surgery, elective healthcare for 1 month or something about that. So that helped us to prevent serious outbreaks in these facilities. What I think was the main reason why we managed to go through with so low rates, because we know that the hospitals and nursing homes are this infection. Now we are slowly relaxing the measures, and the borders are open between 3 Baltic states for 2 weeks already, and now they are opening up. We are opening up for European Union, but only European Union. and we have relaxed the quarantine or self-isolation procedure for 14 days in those arriving. It is a bit risky and tricky, but that's pressure from EU in general to relax the measures. So far, we are quite successful since the rates remain low. So that's where the Latvia is at the moment. Okay.
Well, thanks very much indeed. I might ask you and Dr. Gamkrelidze both to mute your microphones, and I shall turn to Dr. Loblova. I should say that you are, though you are a doctor, you're not a doctor of medicine. The other two are have scientific doctors, but your doctor is in social science. You're in sociology and in health policy, which is your expertise. Could you give us your perspective on what you've just heard? What is the is it a big advantage, perhaps, that these are both small countries which can have everything under control, or what would you attribute this the excellent results that we've just heard to?
So that's right. Thank you very much. I am a doctor of political science, so not even sociology. If you want to get into the hierarchy of social sciences, I believe political science might lie lower even. Hopefully not. And I do work on health policy specifically in Central and Eastern Europe. I do have to say that I usually stop at borders of the EU, so I wouldn't dare talking about the situation in Georgia. But people have been asking what lies behind the success of Eastern Europe in terms of keeping the number of deaths and number of coronavirus infections down. Certainly in comparison with Western Europe or the US, or specifically with especially with in comparison to the UK, which today has become probably an exception, but not in the good sense, as we'd all agree, I imagine. And I would usually say that that there are several reasons. One is that the virus came to the region a bit later, for instance, like my colleague said, mostly through skiers coming back from Austria or Italy, especially Italy, but also that countries of Central and Eastern Europe basically did not waste this time that was that they were given by luck or perhaps lack of business connections and travel connections to China specifically, or to Asia. And they did not overestimate their capacity to respond in a way that hasn't been done elsewhere. And so they've learned from what was going on in other countries. So lockdowns, if they happened, or versions of lockdowns happened relatively quickly in Central and Eastern Europe if we compare the strength of the lockdowns relative to the number of cases into the epidemiological situation. So in that sense, these countries managed to keep the number of infections down. They did not overestimate the capacity of their health systems. And this was a surprise to the world, because the world is usually used to estimating that countries of Central and Eastern Europe have a lower capacity of devising policies and implementing policies, but in fact, policy capacity has to be contextual, and it takes a different capacity completely to declare a lockdown, to evaluate the epidemiological situation at home and in the world, and declare a lockdown and implement it, maybe to enforce it, even though enforcement wasn't so much an issue because populations largely complied voluntarily. lockdowns, but it will take a different capacity entirely to learn to live with the virus. And on this, it has to be said that some of the countries of Central and Eastern Europe, the Czech Republic, for instance, have reopened already, have lifted the lockdowns. In the Czech Republic, the first easing measures have started after Catholic Easter, so around towards the end of March, or around mid-March, when the healthcare system was restarted, when ban on freedom of assembly was lifted, and groups of up to 10 people could meet again, etc., etc. Today, pubs are open, for instance, theaters are open. They follow certain public health measures and precautions, but most areas of economic activity have reopened. So it's been about 8 weeks by now, and you can say in the Czech Republic, at least, the number of infections hasn't gone up dramatically. There have been clusters and hotspots of new infections. Interestingly, the largest one is linked to a coal mine, so it's a workplace hotspot of infections, and not something like a nightclub, which would probably trigger a different public health response and policy response in terms of perhaps rethinking whether it was too early to lift lockdown.
Well, thanks very much for that overview, and thank you particularly for highlighting the point which I perhaps should have made at the very beginning, which is that we really want to get across the idea that the so-called Eastern Europe, which is not a phrase I like because obviously Prague is west of Vienna, but that the countries that had suffered under communism and are seen in many eyes in the West as being underdeveloped or having less good public services than the sort of old rich West, have actually done really well for the most part. Some countries in the old rich West, such as Germany, have also done well. But there's been, there was plenty of worry at the beginning that the poorer countries of Europe would suffer the most, and that absolutely hasn't been the case. We are looking forward to questions from the audience, and there's already one come in for Dr. Dumpis about Latvia, which I'll put to him in a moment. But I want to have a question to Dr. Gamkrelidze first, which is, what are the lessons learned from this? If you look back over the last 3, 4, 5 months, anything you would have done differently, and what is the most important thing that you've learned from Georgia's experience in tackling this pandemic?
I'll say if we will say that Georgia, among all the neighboring countries, now have maybe a success story that still we have an infection under the control. The most experience is how yearly and timely you should respond to the public health threats, including, of course, the global threats like the pandemic. And the yearly start the preparation to this, already we in 10th of January have activated EOC, Emergency Operational Center in National CDC. And every, the day and every, I will say, hour, we have a new information from my colleagues, what happens globally and in the region. And of course, very good coordinating work of the task force and the coordination body under the leadership of Prime Minister, multi-sectoral response, because not only the health sector, as you know, is responsible for this, all sectors starting from the borders, including the police, including the epidemiologists on the borders, including, the labs, etc. And I will say, during this lockdowns and the restriction measures, quite good communication with society, with public, and I will say quite good adherence. What was difficult to reach you know, Georgians are not so easy, the people to, you know, to follow the recommendations always the government. But in this case, during these 3 months or 4 months of our, the past, the adherence from the society was always good. And when I am speaking on my briefings, I always starting the words with the thanking to the society, because the adherence of society and the understanding this not so convenient, uncomfortable, the measures which is connected with lockdowns and are, you know, dedicated to avoid a large spread of the infection in the country. And until today, that's why we are, you know, we have the infection under the control. I don't know how it will be in summer when all Georgians want to have, you know, good holidays, etc., and also the tourists, but still, this is the major what we learned during this period. And once again, in our general and global health strategy, that's to be always prepared to emergencies and to public health threats. This we learned very good. And now in this 3-4 months in summer, we are going to prepare much better if the second wave of the infection in autumn will come.
Well, thank you so much for that. And I think that many people who know Georgia, and perhaps many Georgians themselves, if we'd said 6 months ago that Georgia will be praised for its social discipline and for its good preparedness, they would have been pleasantly surprised. And it's very good to hear this. So I've got a question for Dr. Dumpis now, which is actually a question from Georgia, or at least from someone with a Georgian name, Elena Godzashvili. And she says, what is your testing strategy in Latvia? Which groups are prioritized to be tested, and what kind of tests are you using? Perhaps you could answer that for us.
Yes, our strategy has been always very aggressive from the very beginning. We follow the very strong case identification and the contact tracing, and that's why we have been implementing PCR testing from the very beginning, even by including 2 private labs, because of to increase the capacity from the very beginning. And I think that was a part of the success to compare with other Baltic countries, that we tested more in the beginning. And now, now we have every person in Latvia can get the PCR test if they want. It doesn't take much time, so it's accessible in all parts of Latvia. And we do testing on hospital admissions, and we do screening testing in nursing homes, like a regular screening testing in nursing homes and other high-risk areas. So the peak of epidemic, we did like 2,000, nearly 2,000 tests per million a day. And now we are doing about 1,000 tests per million population a day. So it's not the high, when we started, we were ranking quite high to comparison with other countries. Now we are somewhere average. So we do only PCR testing now with the rapid test methods, but due to lack of reagents, we have limited capacity with this 1 hour testing regimen. But otherwise, so testing is very, very essential for control the contact tracing. Testing, contact tracing, I think that's the most important for this infection.
Dr. Lublova, can I turn to you next to just pick up on what Dr. Gankrelidze said about social cohesion? He starts off always by thanking the public, and it's been a real test of the relationship between state and society and trust in the authorities all over the place. As a political scientist, what conclusions, wider conclusions, can you draw about the way our societies and our political systems work from the pandemic?
Well, I've also heard that the reason why Eastern European populations complied with lockdown orders is that they're just used to taking tough orders and obeying the police, but from communist times. But I always like to play a little mind game and imagine, well, if the outcome had been different, would we not be hearing the exactly same explanation? Right? So you can flip that argument around and say these populations are these populations are used to not trusting the authorities and finding little workarounds and finding informal ways to survive and do their own thing while complying formally with rules. But this hasn't been the case here. So perhaps the response of the population, the adherence to the public health recommendations and orders is just proportionate and commensurate with the severity of the threat as the population perceived it. So in the Czech Republic, sometime in mid-April, about a month into lockdown, some 75–80% of the population thought that the response of the government was adequate to the threat. And another, I believe 10–13% believed that the government wasn't strict enough. So that tells you something about how seriously people took the threat of COVID-19. Now, if you're asking about contestation, I'd say that in Eastern Europe there has been contestation, but it has been rather a contestation of individual measures of individual governments rather than some mass protests against lockdowns like we've seen in the US. So on the contrary, for instance, in the Czech Republic, civil society has actually been collaborating with the government and supporting the government to quite a significant measure. For instance, a hotline for the coronavirus was put up by tech sector volunteers in the Czech Republic. The use of face masks in Slovakia, and then after that in the Czech Republic, and then after that as it spread around, can also be attributed, or some people say it can be attributed to just volunteer doctors and scientists volunteering information and advocating for this solution. And then obviously, if I don't know if you noticed, but the Czech Republic has even been in news about Eastern Europe with the Prime Minister Andrej Babiš tweeting at Donald Trump, saying, well, we managed to curb the pandemic here in the Czech Republic because we're all using homemade cloth masks. And that has also been a rare source of, a rare moment of national pride for the Czechs, where civil society, literally civil society at a very grassroots level, people sat down to their sewing machines and started sewing masks and distributing them. Post would send masks from one person to another for free if they were in a plastic bag. So this has been kind of a positive response from civil society, but not without any contestation, of course.
That's so interesting. It's so often said, I think the Czechs have golden hands because they are so good at anything mechanical or involving any sort of technical dexterity, and that just underlines that. So we have a question for Dr. Gamkrelidze, which is actually about your neighboring country, Armenia, and it is from let me just find it, from Maya Kay from the Voice of America Georgian service. And she says, in the wake of developments in neighboring Armenia, dramatically rising numbers of infection and fatalities, is there a chance of a spillover from Armenia? And what is the Georgian strategy towards a possible infection from Armenia?
Yes, as I mentioned, not only Armenia, all our direct neighboring countries where we have whom we have a border with Russia, you know, with Turkey, with Armenia, and Azerbaijan is situation. It's much worse there in Georgia, and particularly Armenia, which I mean, by territory and the population is fast same as Georgia with 3 million population. And with rapid, I mean, the increase of the infection, currently they have around 17,000 infected, confirmed infected persons. Every day they have several hundred, 300-400, I mean, the new infection. Of course, the situation is not good, but they are fighting. And we have very close contacts with our Armenian colleagues. Last week we had two teleconferences and bridges where we exchange the information and experience what we did in Georgia and what they are doing. And we offered, of course, our Armenian colleagues as well some assistance if they need, particularly to help with in PCR testing, to offer those the PCR kits, or this is not so far, you know, from Yerevan to get in Tbilisi in 3-4 hours, the samples, and test here around 1,000 samples per day or like this. As we offer those to have some, to send some medical teams with the intensive care unit, intensive care specialists, etc., and other as well. Offers like the ventilators, etc. And we still are waiting if the Armenia needs our assistance. Of course, Georgia is always ready because we have very good experience to help each other. All the South Caucasian countries, not only Armenia, same with Azerbaijan, because, you know, we are very close nations and we have a long history to live together in South Caucasus. We are very transparent and open, you know, to help our neighbors.
Well, thank you very much for that answer. I think I want to spend the last section of this discussion talking about disinformation, and we have several questions on this. From Tihomira Doncheva, says, what are the predominant disinformation narratives in your countries about COVID? Are these narratives spread by Russia? And if so, do we see any continuation between Russian health disinformation now and Soviet desinformation in the past? There's a question from my CEPA colleague, Christina Brown. How is the public health sector being affected by disinformation, and has your ability to educate the public been impacted? And then we also have a question specifically about the role of the Lugar laboratory in Georgia. But let me turn first of all to Dr. Dumpis in Latvia. You're obviously very used to dealing with all sorts of Kremlin disinformation in Latvia. You're perhaps one of the best countries in the whole of Europe with your NATO Stratcom Center, which is a real leading center of expertise on this. What's been the story of disinformation during the pandemic, and how have you dealt with it?
As you said, we have some long-term experience with disinformation coming from East. So I think it didn't work very well. So it didn't have a major impact. We have a population that mainly speaks Russian in Latvia and largely follows the Russian media in everyday life. And there was some misinformation that this is like influenza type illness that will pass. And so it had some impact, but I don't think it was a major impact because we have a long-term experience. It was not new. And it was very rapidly counteracted. We got used to it now. We have as you mentioned, we have the Stratcom Center, or we have a countermeasures. We try to deliver information to the people, and we want to show the disinformation, comment on disinformation. And what was more interesting for me, that the role of social media like Facebook was not very huge this time. We know that it had it caused a lot of trouble in the world recently, but Facebook didn't play a major role, and I think so. I don't think we had a major impact of disinformation from abroad, and that was because actually, let's say everybody was on their own in March. You know, every country was sorted, the borders were closed, and you know, nobody really cared about what's happening abroad. Fortunately, now we are waking up from that episode, but it was like that in March. So we were on our own. We had to sort problems on our own, which was a very interesting and useful experience for our small nation, I would say. Okay, thanks.
Well, thank you. I think you're using interesting and useful in a sense that is not entirely positive there, but thank you. I suppose the exception to this perhaps was China, which was pushing disinformation narratives quite hard, both in saying that the Western response was useless and also pushing some conspiracy theories that the Americans had brought the virus to Wuhan in the first place. But let me turn to you, Dr. Loblova. Do you think we overestimate the importance of the infodemic as opposed to the pandemic? Are we searching for a problem that isn't there? And how do you see the balance between kind of endogenous disinformation stuff that is just generated by people's natural panic and ignorance, as opposed to the what may be being pushed into the information system from outside?
Okay, I'm going to disappoint you. I can't actually answer that. So I am not an expert on disinformation, and I would not trust myself to say anything on that. What I can tell you is at least one piece of the puzzle from the Czech Republic, and that's the fact that very early on, from the beginning of the lockdown and the state of emergency and the pandemic, the Czech TV has become a key source of information for most Czechs, and we have some data on that, or for many Czechs. And this is, when I say Czech TV, this is obviously this is an independent and very robust institution that is delivering high quality entertainment, but also it has its own news channel with 24-hour news. That is actually, I'm always surprised how good it is. So it has nothing to do with, for instance, Hungarian or Polish public broadcasting, right? And there have been attempts as part of kind of culture wars to defund the institution, to scrap the license fee, and to bring the institutions under political control. And the fact that at a time of crisis, this one media, publicly owned independent media, has become the go-to source for a large part of the population, that might not actually, I think, make it less likely for the institution to be targeted less, to become politically influenced, but it might make it harder for politicians to be funded.
That's very interesting, because here in Britain we're seeing the opposite. There's a collapse in trust for the in journalism generally, and for the BBC in particular. So maybe some of my colleagues in British broadcasting had better learn Czech and get over to the Czech Republic, where their profession will be held in greater esteem. I want to come back to Tbilisi next, to Dr. Gam Krelidze. Can you tell us a bit more specifically about the role of the Lugar Lab in countering the pandemic, and also the Russian disinformation narrative that's been surrounding it? We have several questions have come in on this, including from my old friend Paul Joyal, who is a great friend of Georgia based in Washington, DC. Over to you, sir.
Yes, thank you. This is the, it's already the old narrative from our big neighbor, from Russian politicians, This has always this kind of disinformation is quite often, unfortunately, has only the political, the background, nothing other. They are mostly, how to say, that the Russians are not so happy that the Georgia has chosen another way, not the way to the north, to the Russia, back to Soviet, and chose the way to the Europe and to the NATO, which is, which is by our society is well recognized, and Russians are so not happy. That's always they are asking why the Lugar Lab, and generally this is not only the Lugar, this is the so-called the laboratory surveillance system in Georgia, public health system, which consists 22 labs. The public health and as well the veterinarian labs, unified by the One Health principle, working together. And on the top is the referral lab, the Lugar, BSL-3, which is only one in the region was, and currently is only one in Georgia. And the Russians are saying that we are doing the other investigation, not the science, but the biological weapons, and why we are working together with Americans. And we are always responding, yes, please, the US is #1 partner of Georgia. Yes, US is #1 supporter of Georgia, and we are very happy and very thankful to the taxpayers of US that they did a huge investment in Georgia to build these 22 labs in the country, to invest a lot in the training of the in the human resources, and we see the results that Georgia has developed quite a good program like the hepatitis C elimination, which is based on the Lugar Lab. And Georgia had until today quite a good response to the COVID as well. And the Lugar Lab here plays, and then CDC, very crucial role. Yes, please, in Lugar Lab, we have 3 or 4 WHO accredited labs, and we don't need now to send for the confirmation these samples for influenza to the St. Petersburg, and we do everything the same here in Tbilisi. We don't send the samples for the polio to Moscow Polio Institute, and we are doing here in Tbilisi. We are not sending the measles and rubella or other samples, to Moscow as well. Of course, this has always only the political background. And I have decided not to respond. I responded a lot of times to Russian colleagues. We have invited the Russian colleagues as well through international organizations, through UN organizations, to come to the Lugar Lab and look, and we offered as well to do their joint, the investigation and the joint science together. And some scientists from Russia, they have been there as well, the journalists. And we are very transparent. We show those all things what we are doing in Genomic Center, in our repository where we have all the especially dangerous pathogens kept, and making the sequencing. Now we can identify if infection is imported in Georgia. For example, now for COVID, we have sequenced around 40, the COVID positive samples, and we know that this cluster, the source of this cluster is coming from Italy, the source of this cluster is coming from Russia, the source of that cluster is coming from Iran, etc., etc. And unfortunately, Russians are not so happy that Georgia is an independent country and not looking to the north. This is the reason why disinformation periodically comes from our former brothers.
Well, thank you very much for that understated response to my question, and I'm sure that it echoes strongly both in Latvia and in the Czech Republic, for that matter. So we just have a few minutes left, and I wanted to just finish up by just asking, what do we need to worry about in the months ahead? There's obviously, in countries like Britain, where we are still in a terrible mess, we have our own set of concerns, but in countries that seem to be emerging successfully from the pandemic and from the restrictions that were necessary to contain it, which is your your countries all fall into that category. What do we need to worry about in the summer and in the course of the rest of the year? So I'd like to just ask you all what you think the big worry is, and then that will bring us up to 4 o'clock when we'll finish. So I think I will go again straight back to you, Dr. Gamkulidze. If you could tell us what's your big worry between now and the end of the year?
Biggest worry is that if we will not so successfully in the communication with the population, and they will be much relaxed now, after this, and they will trust that we already won the epidemic. No, I always say that no. We should be much better now prepared for the autumn than we have been prepared in January, February. And we should be much stronger prepared, and preparedness should be much stronger. This will be my major message. Because the pandemic and unfortunately the coronavirus will continue, and we have to learn how to be cohabitated or to live together with coronavirus.
Thank you. And I should have said that this question comes from my CEPA colleague, Eleanor Anderson, the question that I just put. So thank you for posing it. Dr. Dumpis, what's your big worry for the remaining 6-7 months of this year?
Actually, I have the same worry that we are not there yet. We haven't won the virus, and we will. My main concern would be, would the general public be ready to return to restrictions if it would be necessary? Because people feel kind of tired, and now they are really relaxed. What we see in the streets, they don't even continue following the current small restrictions. And if we need to go back, that might cause some problems. And other worry for our country would be the preparedness of hospitals for the winter period, because summer is always easier for hospitals. So winter might bring up additional challenges with influenza and other illnesses, so that the preparations should not stop now. We should put a major pressure on preparations. Even if the disease would not come back, we still have to put major attention to preparations for something coming. Thank you.
Thank you very much. And Dr. Lublova, last word to you. And I'm not sure I gave you a proper chance to answer a question earlier on as well, which was what have we really learned? So if you wanted to put together what the key lessons to you of the experience so far have been, and what, from your point of view as a political scientist, what do you worry about in the months ahead, both from your Cambridge University England perspective and from your sitting in Prague perspective?
Well, the obvious worry is to get the policy response right, to achieve a proportionate policy response, or some proportionate level of response, because what we've seen during the first waves of restrictions or non-restrictions or late restrictions is that it's very easy to get the answer wrong by a couple of days and have and pay a huge price in terms of human lives, health, as well as the economy. But we've also seen that we can see a bit of an overreaction in implementing restrictions or implementing measures more generally that might be overdoing things a little bit. And in that category, I would put, stopping the health system and kicking all non-COVID patients out of hospital beds, or freeing up to half of all hospital beds for COVID patients that in fact never came, and probably we could have seen that they were never coming in Hungary. That is a typical kind of policy overreaction. But in that same category, I would also say that one of the risks is not to let politicians use the crisis as for power grabs. So something that we have seen in Hungary, in Poland to some extent, we have definitely seen in, well, I can only speak for the Czech Republic, but I would imagine that this is similar across the region and perhaps in Western Europe. We have seen that under the guise of the pandemic, corruption or kind of mismanagement of public funds or slightly dodgy public procurement contracts can happen. And this would be also something that we would need to watch out for, in addition to simply getting the response to the public threat itself right.
Well, thank you very much indeed for that. And thank you to all the people who've participated. I'm Edward Lucas, Senior Fellow at CEPA. Dr. Olga Loblova is a Research Associate at the Department of Sociology at Robinson College, and a Research Associate at Robinson College, but at Cambridge University. That's Cambridge, England, not Cambridge, Massachusetts. You've also heard Dr. Amiran Gamgrelidze, who is the Director General of the National Center for Disease Control and Public Health in Tbilisi, Georgia. That's not the state of Georgia, but the Republic of Georgia. And Uga Dumpis is the head of the Department for Infectious Diseases and Infection Control in Riga, Latvia, and has been the leading face of that country's battle with the pandemic. Please do continue to follow CEPA. Our website, Common Crisis, has a lot of articles about the geopolitical response to the pandemic, and we have other material as well elsewhere on the website, and we'll have more events like this in future. But until we are able to entertain and inform you again, goodbye from me in London, and thank you very much to my fellow panelists and to all of those who took part in this event. Goodbye.